What if I told you your body has a gland that affects your metabolism, growth, body temperature, muscle strength, appetite, and the health of your brain, kidneys, and reproductive system? Would you want to know about that gland? Would you want to take care of that gland? Well, that is what we are talking about on today's episode of NDTV. Hi there, my name is Corinne Brown, naturopathic doctor, labor doula, mother, and host of this episode, where today we are talking about thyroid disease, which affects about 10% of the population. Now, the thyroid is a gland, which means that it communicates via chemical messengers, which are known as hormones. And I always say that the hormonal balance of your body is a very tightly run ship, and that even one little tweak in one hormone can have a domino effect and throw up a whole slew of other hormones. The thyroid gland is a tiny little butterfly-shaped gland right here at the base of our throat that is regulated by hormones produced in the brain. If the brain receives a message saying that there is not enough thyroid hormone floating in the body, it will release TSH, or thyroid stimulating hormone. That hormone's job, just as its name says, is to go down and stimulate the thyroid to create thyroid hormone. So it's a little counterintuitive, but high TSH means that you have low thyroid function. I look at it like this. There's a mom inside making dinner, and she's got her 10 little kids all around her, and she's got an 11th child, her oldest one, who is out in the street playing with his friends. And when it's time for dinner, she sends one little child out to come and get Johnny to come back in. But if he's not listening, she sends another child out, and then another, and then another. She will keep on sending those kids until Johnny gets his butt inside for dinner. The neighbors can now peek out the window and see how well Johnny's listening that night based on the number of kids that there are in the yard. So we can test our blood and see how much TSH there is in the blood, which tells us how well our thyroid is listening. Presuming it's listening, the thyroid in response creates two different types of thyroid hormone, T4 and T3. T4 is created in larger quantities, but T3 is significantly more potent and more biologically active. Only about 20% of that is actually produced by the thyroid. Otherwise, it is converted, it's T4 converted into T3 in peripheral tissues or other organs of the body, not being the thyroid. So the thyroid makes enough for the cells of its body, but it produces enough T4 that if the body needs more T3, it can convert it on its own. If you think about that mom with all of the kids, if she is the thyroid gland, think of her making a peanut butter and jam sandwich for all of her kids so that she creates enough T3 for everyone's needs, but then she leaves a big stack of bread on the counter with the peanut butter next to it so that they can make their own sandwiches if they are hungrier later. So that would be the extra T4 that the body has the ability to convert into T3 if it needs it. So when you have a thyroid dysfunction, it can go one of two ways. You can be hypothyroid, which means an underactive thyroid, which is much more common than hyperthyroid, which is an overactive thyroid. So some symptoms of hypothyroidism would be things like weight gain, hard stools or constipation, generalized chilliness, sadness or depression, fatigue or lethargy or feeling kind of just low and slow, irregular menstrual periods or metrorrhagia, or heavier menstrual periods, which is called menorrhagia, pain in the joints or muscles, generalized weakness, and thin and brittle hair or fingernails or dry skin. So it's less common, but on the flip side of that, hyperthyroidism would look like someone who was very hot, someone who had diarrhea, thin body type or difficulty keeping weight on or putting weight on, people who are manic or anxious or just generally kind of vibrating at a higher frequency. Number one, menopause is highly correlated with thyroid issues. This is potentially because of age, so thyroid function naturally declines as we age. It could also be because of the hormone disruptions that are happening in menopause, or a combination of the two, which is why it is so prevalent. Number 2, autoimmunity. Sometimes the body attacks its own thyroid gland, making it impossible to create or convert adequate thyroid hormone to have it circulating in the blood. The third cause for thyroid imbalance is liver congestion or insufficiency. A large amount of the conversion from T4 into T3 is happening in the liver. So if there is congestion or any kind of insufficiency in the liver, then that conversion will not happen adequately and there won't be enough thyroid hormone in the blood. Another way that your liver is involved with your thyroid is that it is responsible for producing TBG, or thyroid binding globulin. Now this is a protein that floats around in the blood bound to T4, which makes it completely inactive and unable to be converted into the more active T3. So obviously only the unbound version of the hormones are able to be used by the body. So anything that's going to change the amount of TBG, or thyroid binding globulin, floating around in the blood is going to impact the thyroid. There are many drugs, hormones, and other substances that can impact the liver's development of TBG. Another reason why it's important to do a regular liver cleanse like mine, the 21-day detox challenge. Number 4, progesterone and thyroid hormone go hand in hand. Like 2 peas in a pod. Now before we talk about progesterone and thyroid hormone, let's quickly talk about progesterone and estrogen. So they always exist in a ratio in our bodies. They need to be in balance. So if we have one lower, the other one seems like it's in excess because the other one isn't there to balance it out. And this is bad because the thyroid really likes progesterone, so having lower progesterone is no good for that reason. And the thyroid really doesn't like estrogen, so having a relative excess of estrogen, it's like a double-edged sword. The reason the thyroid doesn't like estrogen is because when there's unopposed estrogen, or a relative excess of estrogen, it will increase the amount of thyroid binding globulin, which binds up all that T4, and then the body can't use it. So estrogen is the mean older cousin who runs in and grabs all the extra bread off the counter and the kids are hungry. So taking oral birth control pills is essentially creating an estrogen dominant situation and can lead to thyroid imbalance, which can lead to weight gain and fatigue and other hormone imbalance symptoms or thyroid imbalance symptoms. Now progesterone, on the other hand, sweet little progesterone, decreases the amount of thyroid binding globulin, which then frees up more thyroid hormone to be in circulation in the blood. Furthermore, the thyroid hormone helps to convert a precursor called pregnenolone into progesterone, and it also encourages progesterone release from the ovary. So not only does progesterone help to boost the thyroid hormone helps to produce the progesterone hormone. What a lovely relationship. Low progesterone is also associated with anxiety, which leads me to number 5, stress. How many times am I going to talk about cortisol? A lot. Cortisol is our stress hormone, and we have all got too much floating around. Now the problem with that is that it inhibits TSH from being released from our anterior pituitary to tell our thyroid to make more hormone. Also, the enzyme that converts T4 into T3 is inhibited by stress, illness, and fasting or blood sugar issues. So that's why it is so important to get your stress levels under control and your blood sugar balanced. And the last major cause for imbalance in the thyroid is pregnancy. HCG, or the pregnancy hormone, increases the thyroid hormone in the blood during pregnancy. Made by the placenta, human chorionic gonadotropin, or HCG, looks very similar molecularly to TSH. So in pregnancy you can have an elevated thyroid, an overactive thyroid, but then once you have the baby, that thyroid level would drop off. about 4 to 10% of women will have some degree of hypothyroid symptoms in the year following pregnancy. Most will have it in the first couple of months, and some it will continue on for the rest of the year. Most of the time it will regulate itself and it will not be a lifelong issue, but sometimes it is. So that is it for today. And the thyroid is an important one. It's kind of all-encompassing. So I really wanted to make sure we took the time to go through and really understand what everything is happening. It's a little complex. There's hormones and stuff. But I really wanted to make sure that you understood why it's important that we get the thyroid regulated. So today was part 1 of the thyroid episode, where we talked about what the thyroid is, what are some symptoms of imbalance, and what are some causes of imbalance. In 2 weeks' time, we're going to do part 2 to this episode, where we talk about different testing that you would want to get done, and also different treatment options if you want to regulate your thyroid, so make sure you stay tuned for that one. If you're digging this kind of info, please make sure that you share it with your friends and family using the share button below, which looks just like this. If you would like to start receiving my newsletter and join my amazing tribe of health-conscious mamas, make sure you hit the Join Now button right below this video. Thanks so much for tuning in this week, and remember to tune into your thyroid health this week as well. Because remember, if mama ain't healthy, ain't nobody healthy. And I suppose this week we could also say, if the thyroid ain't healthy, ain't nobody healthy. So make sure you tune in to the next episode to hear how to make that happen. Thanks again so much for watching, and we'll see you next time on NDTV.